Richard Ross. I'm the chairman of Rosetrees Trust, which is a private charity. We support cutting-edge medical research.
Some of the things we've been doing with the Rosetrees is developing new materials to help to repair the body.
Over the years we've supported hundreds of medical research projects. Currently we have about 200 and they cover every aspect of medicine.
They're really looking for these projects that can make a difference in patients' lives.
I think the Rosetrees Fund is unique because what it does is it provides seed funding for biomedical researchers like myself that are often really concentrating in the lab to be able to carry on to deliver some of those discoveries to patients. And it's that in-between funding that I think the Rosetrees Trust really helped with.
I'm working on heart disease, specifically aortic valve calcification, and hopefully my work will lead to interventions that let people avoid surgery.
I'm working on developing a new nanoparticle-based system for early detection of cancer and treatment.
I'm working with cardiovascular calcification, and my main objective in the end is really try to save 10 million persons per year.
Over the years we've discovered one sad fact, that medical research can't move forward without money, and there's never enough money. It's the funding that keeps them going.
Obtaining funding is the lifeblood of our research. If you come in with a new idea or a novel concept, pretty much impossible to get funded unless you're really well established. How Rosetrees helped me sort of get going in my research was absolutely crucial at the time. I also had two people that were really interested, really good young clinical fellows that we had salaries for, but we didn't have any money to work in the laboratory. And what Rosetrees gave me for 2 years was money for their consumables. So that seed funding from the Rosetrees Trust was absolutely crucial to the whole project.
They fund an enormous amount of projects, really wide scope, a really wide range, and they have a very flexible approach to the funding that means that actually a small amount of money can go incredibly far.
If somebody wants to co-donate, if you want Rosetrees to help you, our expertise, our teamwork, our system will give you the very best value for money.
As non-professional advisors to a charitable trust, they helped us hugely. They evaluated projects for us. They sourced the projects in the first place, and they helped us with administration. That was a huge amount of work taken off our shoulders, and we were hugely grateful.
One of the things that Rosetrees does that's very different is they take a very personal approach to funding the research. I mean, for them, every single pound counts. So they look very carefully at the projects they fund. They really get to know the researchers. And most importantly, they pick the most high-impact clinical projects that are most likely to help patients.
What is very clear when we have these meetings is that the delivery to patients is crucial.
What makes us personalised is that we go and visit all our London researchers, and if possible we either visit or have phone conversations with our out-of-London researchers.
Follow-up was really important to us. We wanted to follow particularly the scientists that we had sponsored, the young scientists that we'd sponsored, and Rosetrees has made this possible. They've kept us in touch with them, sent us reports, and we meet with them on a 6-month or annual basis. Rosetrees arrange all of this for us, and it's fantastic.
I myself am very passionate about my work, but to have somebody else believe in it and say, yes, I think that there's potential in the future of this, and I think it's an important problem that you're addressing. I mean, I think that provides you with an enormous amount of
I think it's really
motivation.
one thing that we like so much on the Rosetree. It's not that they just give you the money for you and they just forgot you. So time by time they come here, they ask about, and in fact we love someone come and ask about what works, so we can show what you're doing. So it's not like a lot of agents, you get the money and maybe in 2 years you send a report, but you don't have this interaction with the person who really cares about your work, right? So this is what we really like also on the Rosetree, because they care about our works, they want to know what is going on, and so this is one big advantage.
Would I recommend them to a charitable trust? Absolutely, but I would also recommend them to an individual who wanted to give money to medical research on their own.